Also in the short term, we need some job training programs. If you go to my website, I have 30 detailed position statements, and one of them is a job training program to train people. We need tens of thousands of energy sector workers over the next 10 years. The energy sector workforce is aging, and we're going to have a real shortage of energy sector workers. So we should be putting money into job training and education. I've been volunteering with the Hartford schools for 19 years. I see firsthand, not just in Hartford, how our education system is not preparing our students for the workforce. And in the long term, if we don't have an educated workforce, we're not going to grow our economy. So we need charter schools, we need vocational schools, and I could go on and on about that. Right. I'm an educator. And then finally, if we're worried about jobs, we have to get our government debt under control. Because long term, we have so much debt. We need to freeze federal spending. Congress just approved an increase in overall of the domestic budget of 10%. Every institution I know has frozen spending or even reduced spending. I don't understand what they're thinking. We need to get our debt under control because long term, otherwise, our economy is going to be even worse.
But John, when you answer this question, you did mention the multinational corporations taking jobs overseas. I'd like you to just expand a little bit on that, where in this recent Supreme Court decision, which allows now these large corporations to have a political voice unrestrained by the laws that are currently out there, that they can run as many ads as they want and spend and reach as deep as they want into their multi-billion-dollar treasury. Yeah. To run political ads.
And they're multinational.
Yeah, and they're multinationals.
Yeah, that's a big problem.
Yeah, and I don't think everybody really realizes just what of a problem this has created by the Supreme Court.
That's a good point. Yeah. All right, so let's move on.
Okay. A senator from Connecticut has a particular challenge in the health care debate, representing tens of thousands of people who are uninsured or underinsured, as well as thousands of people whose livelihood depends on the private health insurance industry. How would you reconcile these constituencies to achieve meaningful reform?
I think that's a very leading and not a very good question. The health care bill that just passed the House, and it looks like it's going to get through the Senate, even though there were a couple of glitches today. It's a big shot in the arm for the insurance industry.
Yes.
It requires every citizen to purchase private health insurance, and it provides large government subsidies for them to do so. So we're actually going to see a large transfer of private and public money to the insurance companies. So I don't think this is a problem. I'm more concerned about solving healthcare issues, so I know the next question is about that as well. I watched the debates.
Right.
So I'll just say that I don't think those are conflicting issues. So let's...
All right, well, let's get to the next question then. Identify and discuss 3 approaches that you would support to lower the cost of health care in America.
Well, a lot more than 3 are needed. We desperately need to reduce the overhead in our healthcare system. Our overhead is so much higher than it is for any other developed country. And people have been miseducated about things. They think that there's what we have currently, and the only other option is socialized medicine, when in fact there are significantly different healthcare systems around the world. The system in Canada is very different from the system in England and Great Britain and the system in, for example, Germany and France. And there's a wonderful book out there called The Healing of America by T.R. Reid. I know I've talked about it on this show before. I encourage everybody to see it. In fact, you can watch my previous episode on healthcare on YouTube, where I go into great detail about healthcare. The systems of France and Germany are very similar to ours in that they have private insurance and private healthcare providers, but they function as a single-payer system. And that's what we need to emulate. So the current healthcare bill does about 40% of what we need to do. Everybody's celebrating and crowing about it on the Democratic side, and everybody on the Republican side is screaming and yelling about it. Neither one of them are really representing the reality of the situation. it's time now for Congress to roll up their sleeves and really get to work and address cost control. You know, so we need to streamline the information systems. I mean, France is a really wonderful model to look at and to emulate the things that they've done. We need to streamline the information system. We need regulation that will make the system function like a single-payer system. Even though we can have many, many different insurance companies, it could still function as a single-payer system.
Right.
And we need to reduce redundancy. You know, right now, some patients will get the same test done over and over again because they go see another doctor for a second opinion if they had access to the information. So that would help. We do also need intelligent tort reform. When President Obama held that healthcare summit, when he invited both parties to sit in the room together, the Republicans actually had a couple of decent ideas there that I wish he had stood up. Imagine how powerful it would have been if he would have said, okay, we'll incorporate those ideas as well into our healthcare bill. That would have put the Republicans on the spot, and we would have seen if they really, really wanted real healthcare reform or not. So intelligent tort reform would help. It would reduce overhead by, it's estimated, between 3 and 10%.
Yeah, easily, you know.
Yeah, I mean, all this defensive medicine.
Doctors paying $100,000 a year in insurance premiums.
That's right. That's right. And they do defensive
sued.
medicine where they order. I had a test done at my last physical that, after the fact, I realized it was fairly expensive too. I realized that it really wasn't necessary. So another thing we can do is we can repeal the antitrust exemption that insurance companies have.
Yes.
We could go on and on about that. That was discussed in the other debates as well. I think that would improve competition as well. And then I think we should offer Medicare as a public option for everyone. And really look at what the cost is and pay for it. Because that current bill doesn't do that. And you know, the Democrats who passed this bill, which I think does a lot of really good things, have not been honest about the long-term cost of the new system. And we have to look at what it's really going to cost and how we're going to pay for it. We need to cut our overhead by 30%. Medicare is facing a $36 trillion shortfall over the next 75 years. And no elected politician is even talking about this. That's the real problem. That's the biggest fiscal problem we face. And so we're only 40% of the way there. We have a lot of work to do if we're not going to bankrupt the country with healthcare.
Well, I think if we do nothing, the country's on its way to bankruptcy.
Yeah, I agree. That too.
Yeah,
I agree.
so.
No, I would have voted for this healthcare bill, but we need a lot more work. I'll mention one other thing. We should offer free medical school. We should start a new program. It should be like the military, joining the military, but it's the medical military, where somebody signs up, like the ROTC.
Right.
They go to medical school for free, and then they commit to work for 5 years in a free clinic.
I think
Free walk-in clinic
Yep.
where you don't even have to give your name. You just walk in, you get treated. Talk about cutting overhead.
Right.
You know, an emergency room right now.
But maybe not work for free, but work for a
no, they don't work for free.
Right.
The clinic is free to the patients.
Right.
They get paid by the government
Right.
a set amount.
Right.
And yeah, thanks for clarifying that. But yeah, that
Won't be
wouldn't
able to
work
pay
very
the
well,
rent.
would it?